COVID-19 is putting a spotlight on the biomedical community, which is at the forefront of the response to this pandemic. In particular, the U.S. biomedical workforce is dependent on international medical graduates. International medical graduates bear a very large burden of the frontline medical workers. We define international medical graduates as anybody who completed either a medical degree or a PhD outside of the United States and are non-citizens who are currently in this country pursuing additional training. I'm Matt Sparks. I'm a nephrologist at Duke University, and I'm joined here by my two close friends and co-authors, Dr. Maria Clarissa Tio and Dr. Javier Nara.
Hello, everyone. I'm Maria Clarissa Tio, a clinical and research fellow in training at the combined program of Brigham and Women's Hospital and Massachusetts General Hospital in the field of nephrology.
So hello, everybody. I'm Javier Nara. I'm a nephrologist and assistant professor of medicine at the University of Kentucky in Lexington, Kentucky.
And we're going to talk about our paper, which was recently published in Mayo Clinic Proceedings. The title of that paper is "The International Biomedical Workforce is Critical to Our Response to COVID-19 in the United States." In our field of nephrology, it's particularly true. A recent survey conducted by the American Society of Nephrology shows that 1 in 4 trainees are either on a J1 or an H1B visa. Individuals on visas have to undertake multiple different hurdles in order to establish their careers and to maintain practicing medicine. Dr. Tio, can you tell us more about what a trainee has to go through in order to stay in the United States?
I want to give the perspective of a physician in training here in the US on a J1 visa in the context of the evolving COVID-19 pandemic. I want to highlight how getting here to the US to train is a complex and multi-step process. So for example, for a trainee to come here, there is significant back and forth among the visa applicant's home institution, training institution, state licensing board, and the Educational Commission for Foreign Medical Graduates. Once the approval is obtained by the US State Department and the documents are received by the applicant, it's only then that the applicant can schedule an interview in the US Embassy or consulate in their home countries. And once they get their visa and buy their plane tickets, that's the only time that they can come here into the US to start training. So in the context of the COVID-19 pandemic, immigration and travel policies are evolving in other countries, not just here in the US. So as you can imagine, any change in one of these factors can lead to the physician not being able to come here to train or renew their legal status. This puts both the physician and the training program in a bind. And just to put it into context and to highlight how important this issue is, currently there are 12,000 physicians on J1 visas that's being sponsored by ECFMG. And I'm not even counting those on H1B visas. In 2018, foreign-born physicians account for 28% of the physician workforce in the US. So our goal is to bring this to everyone's attention, how the pandemic and the consequent changes in immigration policies across the world is affecting this important workforce here in the United States. And from the perspective of the well-being of trainees here in the US, physicians on visas are currently not advised to travel outside of the US at all, given how volatile the situation is. So I want to highlight how it is important to be cognizant of what trainees on visas are undergoing right now, given the uncertainty, and for programs and leadership to find ways on how best to help and support them. Thank you.
I myself was on a J1 visa when I did my training in nephrology. And I want to emphasize that a significant number of international medical graduates in the US are on this type of visas. The most common one for training is J1 visa. A change in status from J1 to H1B will be required, most of the time through a waiver program, as an option for foreign physicians who desire to stay and work in the US to have a viable alternative to continue their stay in the United States. So specifically, J1 visas sponsored by the ECFMG are subject to a return to home residency requirement at the end of training for a minimum of 2-year period. This is important to know because after this can significantly affect the transition period for these individuals in the context of searching for job opportunities, both in academic and private sectors, and also for career development for some of the clinician scientists and educators that are interested in pursuing careers in academic medicine. Now, one should recognize that this workforce is very important for medically underserved areas, because most of the time the requirement for these J1 waiver opportunities is to serve either a medically underserved community or be in a location that doesn't have enough physicians to supply the demands of the population. So this workforce, both in the private sector and in the academic sector, is very important for the healthcare workforce in the US. So here, through this article, we're all advocates to protect this vulnerable and vital sector of the US healthcare workforce.
Since the current complexity of the immigration process is now superimposed upon a global pandemic, it is of utmost importance to ensure our international biomedical workforce is preserved. The US biomedical infrastructure is dependent upon this diverse group of individuals, and we call into action the entire medical and scientific community to advocate and protect this vulnerable and vital sector of the United States workforce.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.